Does occasional binge drinking mean you're an alcoholic? You may need to understand some specific terminology to answer that question. First, take the term alcoholic. Many people, professionals and lay people alike, use this term to describe a person who drinks heavily. Unfortunately, the word alcoholic bears many years of stigma and accumulated cultural baggage. So the science community is trying to move away from using it because of its derisive and limiting connotations. Nowadays, clinicians use more person-first language in treatment because it regards individuals as whole human creatures and not as a specific condition. Hopefully, patients will learn to adopt person-first language in their self-speak as well. So instead of an alcoholic, people can see themselves as people who may unhealthily use alcohol. Diagnostically, alcohol use disorder, or alcoholism, is a severe manifestation of another clinically accepted phrase, unhealthy alcohol use. It refers to when a woman drinks 3 drinks per occasion, or 7 drinks per week, or a man consumes 4 drinks per occasion, or 14 alcoholic beverages per week, according to the National Institute on Alcohol Abuse and Alcoholism. So where does binge drinking fall on the alcohol use spectrum? Well, most people who binge drink rarely enter the AUD category. The term binge drinking refers to patterned drinking that elevates a person's blood alcohol concentration, or BAC, to 1/8 of a gram per deciliter, which for a man could mean drinking 5 or more drinks, or a woman consuming 4 or more drinks within 2 hours. It's easy to imagine this happening on a Friday night hanging out with friends, or when coupling binge drinking with some Netflix binging, isn't it? In the long run, binge drinking and heavy alcohol use can increase the risk of developing AUD. But, as with most substance use disorders, other factors can also influence the chances of developing AUD, such as trauma, mental health difficulties, or early childhood drinking. A family history of alcohol abuse or hereditability accounts for nearly 60% of AUD risk. The World Health Organization developed a self-assessment test for gauging personal alcohol use, called Audit, the Alcohol Use Disorder Identification Test. It comprises 10 questions designed to assess alcoholism risk. Low scores may ease anxiety among moderate drinkers, including occasional binge drinkers. Visit www.auditscreen.org. Many people have issues with alcohol use. Some seek sobriety, and others merely moderation. If you think your drinking is getting out of control, it might be time to speak with a clinical expert who will treat you as an individual, not as a drinking problem.